New at 5, a class action lawsuit against Blue Shield over the shutdown of health insurance plans. Eyewitness News reporter Miriam Hernandez tells us customers who are dropped can sign up for a different Blue Shield plan, but it's not as good.
A rude surprise is what eye patient Deborah Goodwin says she got when she learned that her insurer, Blue Shield, was closing down her health plan and that she had to get an inferior replacement policy. Less coverage with a higher deductible.
Basically, they said, I'm not getting the coverage I have now, and I have to pay a $2,900 deductible, but nothing goes toward that deductible.
Goodwin is one of 300,000 Californians, baby boomers and older, who are joined in a class action lawsuit filed by Consumer Watchdog. Advocates constructed a flow chart, which they say illustrates how Blue Shield skirts the law on insurance caps.
We only figured it out when we started getting complaints from people who said, I just lost my health insurance policy, what can I do?
Blue Shield responded in a statement saying, quote, "The allegations are false. We comply with all aspects of the block closure law and have since it was enacted." Unquote. Blocks are insurance plans. Watchdog says Blue Shield started a practice 2 years ago of closing blocks that cover aging patients. Coming on July 2nd, another round of closeouts. 23 plans will be eliminated. Blue Shield does offer alternative plans for seniors in this situation, says Watchdog. Turns out, though, the policies are either more costly or they significantly reduce benefits. As for switching carriers, that's even more expensive or even impossible for patients with pre-existing health conditions.
Without telling anybody, they close these policies, and this is when the death spiral begins.
Advocates want the court to block Blue Shield from closing policies on July 2nd. They also hope complaints stir state regulators to take a closer look at Blue Shield's practices. Miriam Hernandez, ABC 7 Eyewitness News.